This is a research study that was actually conceptualized by Marcella, who was a developmental pediatric subspecialty fellow at the Glenrose a couple of years ago. And she noticed that lots and lots of the families with whom she interacted in the pediatric diagnostic clinic had multiple children diagnosed with developmental disability. And she really felt that there was something unique about her interactions with those families, and looked into the research, and there really wasn't anything out there about that unique experience. And so we decided to study this in more depth. So Marcella is in Costa Rica and unable to join us today. But this really came from her passion of working with these families. And then I was also able to engage some of my OT students in the study as well. So their names are up here too. So a little different than other speakers in that I'm going to speak specifically to this one study today. And just a little background, probably not surprising to this audience, but the prevalence of developmental disability is quite high. And so these statistics do include learning disabilities, which are estimated to be about 1 in 6 children. But the point here is this is common. And then the odds of having a child with disability increase if a sibling also experiences disability. So this is common in general, and then more common with siblings. So what we found, again, probably not a surprise to people here, is a lot of the research talks about burden. So things like mental health strain, decreased well-being outcomes, things like depression, anxiety, stress, associated with parenting children who experience disability. But this also represents a bias in research. Research tends to focus, historically, has tended to focus on challenges that families experience. And so what we really wanted to do was to explore the unique experiences of parenting multiple children with disability. So there's lots of research on parenting experiences in general. So we really wanted to hone in on the multiple children. We talked about lots and lots of areas of focus, and we landed on looking at parental well-being and social participation. So families' ability to participate with others and in their communities, and that we did want to explore positive experiences. So Sean talked about strengths, and David talked about strengths, and he talked about the deficit-focused approach to disability. And gosh, that must be exhausting for parents. And so we really wanted to shift the negative narrative that's much of the parenting research, and focus on positive experiences. Of course, we acknowledge challenges. It would be inappropriate not to acknowledge, but to really try and shift that narrative. So because there was so little out there, we really took an exploratory approach to this study. So we did use a qualitative approach. I won't go into detail on the methods, but just to know that the approach that we used is often used to guide research with the potential to inform clinical practice or practice change. Given the timing of the study, we did switch to Zoom interviews because it was during the pandemic. And I think that's a real strength of the study because it allowed us to move outside of Edmonton. So our participants came from across Alberta, so various urban centers, rural centers. And when we're looking at outcomes like well-being and social participation, I think those varying perspectives were important, their strength of the study. We did include parents who had parented their children for at least 2 years. And that might seem odd given that our age range is 2 to 12 years, but we did have parents who fostered children in the study. They had to live in Canada for at least 1 year. And that was just to sort of not complicate the data with also things about moving to a new country. And then they had to participate in an English language interview because that's the language that we, the interviewers, spoke. We decided on an age range of 2 to 12 years with at least 2 years being diagnosed prior to the interview, that was just to sort of not be navigating the sort of brand new notion of disability and all the service systems, everything that we just talked about. Yeah, I think those are the important parts. We did have some families who had children older than this age range, but they also had at least 2 children within this age range. And these are just some example questions. So we did have a semi-structured interview guide that the various different interviewers used to have consistency, although what we find with this type of research is we have our questions in front of us, but we have such deep conversations that we tend to address all our topics without even asking the questions most often. But we asked about children's strengths. We asked about parents' knowledge of disability before their children were diagnosed. We really dove deeply into the parenting experience with multiple children and how that differed between the first child who was diagnosed and then subsequent children, and then around our topic areas. Our interviews were about 45 minutes to an hour, so lots of time to dive deeply. So these are our participants. These are pseudonyms. So these are not their real names. And you might notice that we had 10 mums. So we did not recruit mums, but all of the people who responded were mothers. And that's quite common in research. And so I'd be interested in doing another study exploring fathers' experiences, because there is some literature out there that mothers and fathers' experiences can be different. And I think these topic areas around well-being and social participation, that might be an important topic to dive into. But we are going to present data on 10 mothers today, or from 10 mothers today. And what this slide shows you is all of these children are children who experience one or more developmental disability. And then 2 of our families also had children who did not experience any known disability. Specific diagnoses varied. And as Christy sort of spoke about in her question, that most children actually had multiple co-occurring diagnoses. And sort of appropriate to today, autism and ADHD were by far the most common diagnoses in our sample. And then other diagnoses did include learning disability, Tourette syndrome, OCD, anxiety, visual impairments, dyslexia, depression, FASD. So lots of different diagnoses represented. These children ranged from 2 to 23 years old, and there were a total of 33 children across these 10 families, and then 30 who experienced disability. So about half our mothers lived in Edmonton or Calgary, and then the other half lived in smaller centers in Alberta or more rural locations. So nice diversity there. All of our parents were partnered, and the mother's average age was about 40. So, and then what else did I want to say? Well, I think just that each family had unique experiences, really unique profiles, but there were many, many consistent experiences between the families, regardless of their individuality. Okay, so now the most important part. So for those of you not familiar with qualitative research, analysis is a very systematic process. And so we look at data from individual families, and then we really dive deeply into some of the connections between our families. And so we did have 5 of us involved in the data analysis process that took place over many, many, many meetings. And where we landed was 3 overarching themes, and then sub-themes within those. So our overarching themes, you can see, are knowledge is power, shifts in self-care, and connection or disconnection, and engagement with others. And then lots of the sub-themes really cross categories. So for example, advocacy, we felt really fit into all of the data, all of the themes that emerged. So I'll go through each theme in more depth. So our first theme, knowledge is power. really depicts the mother's journey of feeling more knowledgeable with each subsequent child who did experience developmental disability. They describe the power of disability knowledge, of associated skill sets that they developed, and of embracing advocacy roles. They talked about knowing very little about disability prior to the diagnosis of their first child and an exponential growth in knowledge following the first diagnosis. Parents really learned how to adapt quickly with the second or more children. And as I'm sure you're aware, educating themselves through any means available. With subsequent children, they really felt that they knew better where to look for information. They recognized signs of potential differences in subsequent children much earlier, and they trusted their gut feelings more. The knowledge gained from having one child with disability empowered parents to be proactive at accessing diagnoses, resources, supports, and funding for additional children. So they felt like they were more empowered with subsequent children. And then with feelings of empowerment, some mothers who had initial feelings of guilt and anxiety around the first child's diagnosis shifted to feelings of confidence and acceptance. And so, for example, this is a quote from Shelley. She said, with Jack, I carried a lot of guilt. I didn't necessarily feel that guilt as much with William. There was more acceptance, I guess, more recognition that the diagnosis was a doorway to get you the help that your child would need, as opposed to a sentence on your child or a stigma on your child or on you as a parent. And then with this increased knowledge, as a result of having more than one child with developmental disability, many families felt really empowered to take on the role of advocate for their child. And this increased knowledge spanned beyond disability to include knowledge of obtaining diagnoses, supports, and services. So advocacy is a necessity for many parents, but they really felt like they could recognize the child's needs before others, and they knew what to do. And the parents took a lot of comfort in this. For many parents, enhancing their awareness and understanding of disabilities and taking on the role of advocate was described as a positive output or outcome of having multiple children with disability. It allowed them, or it resulted in them viewing their children's differences more positively, and really appreciating their children's strengths. And so Isa said, with the diagnosis of my second child, I felt like I had the ticket to all I need to help her. And Hannah said, you feel less stressed about it, more aware of what's available. I already knew about SLP and early intervention. I had firsthand experience as a parent accessing all those things. So when he came in, I was like, oh, he's behind. I knew. I was already seeing the early intervention worker and was like, hey, could you add him to your list? Our second theme, we labeled shifts in self-care. And it really depicts the shifts in the mother's well-being, influenced by the unique experiences of parenting multiple children with developmental disabilities, so differently than when they had one child diagnosed with disability. They did represent both negative and positive outcomes perceived by the mothers, and how parenting multiple children did shift their perspective over time, leading to feelings of empowerment, empathy, and purpose, despite the challenges and increased challenges, as they reported, of daily life and participation. So all participants noted a decreased ability to engage in self-care activities. I'm sure that's not a surprise to the parents who are here today, and beyond what is expected of a parent in general. Having children influences one's ability for self-care regardless, but above and beyond that. They also talked about how children often have different abilities and challenges than each other. And so that's sort of an added layer of challenge in supporting multiple children. Access and availability of appropriate childcare and respite services was a major contributor to parent well-being and the ability to practice self-care. And unfortunately, parents face barriers to respite. They specifically noted their decreased well-being as a result of support and time. They also noted that respite, it's hard to get anyway, and was increasingly difficult to get when they had multiple children. So feelings of exhaustion and isolation were common, and multiple participants talked that if they were able to receive respite support, it didn't support their self-care because they needed to use that time for things like household tasks, chores, maybe grocery shopping, but not for their own self-care. They felt more exhausted overall, And they also recognized how isolating it can be for a parent who has multiple children with disabilities, again, above and beyond one child. So to go out with their children, many participants talked about how spaces don't meet everyone's differing needs. This often did relate to sensory preferences and children having different sensory preferences. And so that did create isolating experiences for families and parents. And then a lack of understanding, which we've just talked about as well, was also led to increased isolation. So Ava said, I'm just burned out. I'm tired. I haven't slept in like 4 years. Or Isa said, well, they go swimming with respite so I can get stuff done. Or they take them sledding so I can get stuff done. It's not respite. So although we acknowledged some of the isolation and exhaustion, parents really talked about how parenting multiple children with disabilities generated feelings of empowerment, purpose, and empathy. So some participants left their place of employment to focus on parenting full-time, and they found new hobbies, new activities, or volunteer opportunities, often within disability organizations. And that really provided these mothers with a sense of purpose. So for example, families shared how now they volunteer for groups working with children or people who also experience disability. Parents also talked about how feelings of empathy increased since parenting their children. So Hannah says it's really helping us grow as people, learning how to be more patient and understanding of people with differences. And Ashley said, I feel like a totally more understanding and thoughtful and compassionate person than I once was. So overall, our participants really felt that their children made them a better person. And then the final theme in our data, we initially titled Connection and Engagement with Others, but then we did have to acknowledge sometimes there's disconnection with certain others. So that's why there's a bracket there. It acknowledges the struggles of work and instrumental activities of daily living and social and community participation. Yet amidst these feelings of isolation and exhaustion, participants remained really positive, and they ultimately concluded that being a parent of multiple children with disability enhanced many aspects of their life, including family connection, and it provided them with a sense of meaning and purpose. So many parents discussed how everyday tasks like going to the grocery store became more difficult. And I've talked a little bit about this already, especially if they have children with differing preferences and needs than each other's. Lots of parents talked about how their own social lives had shifted since having children with other people and with their spouse. They talk about how it's hard to go out because of a lack of competent and trusted babysitters, that sometimes it's hard to have or to remain friends with people who don't have children who experience disability because they just don't understand their lived experience. Overall, they talked about how going in the community can be very complex, as there's lots of different things to consider. However, they talked about deep, meaningful social connections, often through relationships built within the disability community. So Leah quoted, they all enjoy it, they meaning their children, but Jacob does not for very long and no one can keep going and he's happy being overstimulated, but Jacob, I think we're about halfway through the time there and he wants to go home. So those differing abilities really matter. Ashley talks about how we don't receive invitations, to be honest. What I personally really feel is the lack of being invited to a village. We feel lonely. And Ava said, it's hard to have friends with people who don't have kids with high needs, to have friends at all. However, these mothers also talked about how often their spousal relationship was really strengthened through parenting their children. They talked about how they celebrate success together, they work together to solve challenges, how they can be a real team. They also talked about the beauty they saw in the unique bonds between their children who experienced disability, and how they really felt like they understood each other and had a tighter bond than with siblings who don't experience disability, or if they had a sibling who didn't experience disability. So Beth says there's a kind of us bonding too, of strategizing. I love it when they're interacting, they accept each other. And Leah says, in some ways, he understands his brother more than a neurotypical brother would. These positive family moments made the mothers really grateful. And despite challenges, families really talked about a lot of comfort and support in each other. And so I was reflecting back on the motivation for this study, and because it really was enacted by a bunch of healthcare professionals, and we do support families. And I think this study reminds us of a lot of the really important things that we need to do to optimize support that are really beyond sort of that medical healthcare system. And then I think about existing research and the focus on professionals and the deficit-focused approach. And that's not the stories that these families focused on. Yes, they reported challenges, but they really talked about their successes. So David talked about sort of the markers of a good life. And I was reflecting on this when he was talking about that, because this study included a lot of different experiences than people envisioned, and lots of unexpected different markers of a good life. And so I think what's important for professionals in particular, and for families, is just to acknowledge that life is different, not worse. There are challenges, and we have to acknowledge the challenges and be advocates for support, and especially for things beyond our child's needs, but for things that might support self-care for parents and connection for parents. We also need to acknowledge hope and draw on the strengths of families. And we need to consider connections to the disability community. So not that people have to engage with the disability community, but all of our families talked about sort of finding a place where they felt understood and accepted, developed meaningful friendships, parent-to-parent expertise, and advocacy. This was a community that none of these parents expected to belong to before they had children, and now they value it so immensely and find it so rich. David mentioned some of his best learning came from other parents, and this study and other research does recognize that. But I think what our data showed was it's not only a benefit to sort of the receiver of that parent-to-parent mentorship, but the meaning that being that mentor and that friend held for the participants in this study. And so I don't have any hard and fast resources like some of our other speakers shared, but I think just to think about this lens and this approach when we work with families, and for families to keep being the strong advocates that they are for their children.